Hello, I'm Bill Terra. Following the video that I posted last month on the issue of anti-science bias, I've had many conversations regarding the issue of vaccination. Today I want to speak more about medical freedom and what that implies. I was exposed to the writing of Japanese philosopher George Ohsawa in the 1960s. He proposed a way of thinking that was new to me. It was the idea that everyone should accept responsibility for their own health. He envisaged a society where health was created from the ground up, based on individual and family health habits. Medical freedom was part of this way of life. Many ideas that were rejected as anti-science then are now broadly accepted, especially in the fields of nutrition, overuse of antibiotics, and the misprescription of drugs. Who would have thought then that the fourth leading cause of death in America would be prescription drugs? Over the past decades, I've never witnessed a greater assault on medical freedom than is happening now. Never has an individual's ability to decide on whether to accept medical treatment been so aggressively attacked. The media has framed this issue as one of social responsibility and even of patriotism. But we need to step back a little bit and see the larger issues in this narrative. It's something that many are reluctant to do in the rush to judgment. One thing is certain, the issues of health are very emotional. That makes sense. Health is fundamental to life. We should take every opportunity to protect our health and our life. But do we do that? Certainly the answer to that is no, we do not. Public attitudes are seriously skewed toward viewing health as something that's accidental, outside of our control, or the gift of medical intervention. And nothing could be stronger or further from the truth. Health cannot be advanced by pharmacology or medical technology, but by human behavior. It has to do with how we live daily. Health reflects sanitation and a clean environment, body movement and nutrition. It has to do with a respect for the environment and both human and non-human life. The overriding social philosophy regarding health is that we can ignore these facts and simply get patched up when our bodies and minds fail us. There has been no move to inform the public on ways to improve their immune system, no nutritional advice on how to reduce the morbidities that contribute to COVID death, no real study on the impact of limiting physical activity and social stimulation in both the young and the old. The prevailing message has been one of fear. The core of freedom is autonomy. There is no stronger freedom than the autonomy to try to save one's own life. Demanding our reliance on medical technology and paternalistic medicine is not patriotic. It is compliance with a broken system. Medical treatment should be available to those who want it. It's their right, but not at the expense of those who choose to avoid it. A true patriotic move would be to remove the money from the pharmaceutical industry, the food industry, and the insurance industry from government decision-making. A true patriotic move would be to take urgent action to save biological diversity, to consider healthy food, air, and water a basic right, and to stop the subsidy of industries that undermine public health. Talk of medical passports and required medication should cause great concern to us all. They are not signs of a healthy society, but signals that society has been found unfit for improvement by the powers to be, and only fit for autocratic control. This is not a political issue in the narrow sense of political parties. It is, however, an important social issue. It is not a rejection of science. There's no space lasers or deep state cabals or billionaire conspiracies. This is not that. The reason that America has the highest per capita death rate for this influenza is not because it didn't have the right technology. It's because it's a very sick nation. And that same thing applies around the world. Obesity and chronic disease are up 2 times higher in America than in other developed countries. If we do not address these issues, we are simply putting off meaningful action and hoping for the best. There will be other viruses, other variants. What will we do then? Take more medication? This is an opportunity to really discuss health and to get healthy together, and we should take it. Thank you for listening.